Well, we all know how expensive medicine, medication, medical care, visiting a doctor even is. And as a result of that, many South Africans cannot afford quality health care. Well, telemedicine, it's becoming quite popular. It's being touted as a solution to the problem. It essentially offers a link to professional doctors at the drop of a hat, regardless of the patient's location. And I imagine also a little bit cheaper. Or is it? Well, let's find out from Rodney Taylor. He is the MD of tech company Guardian Eye, making time for me this afternoon. Hello, Rodney. Good to have you on eNCA. Where did the idea come from? Afternoon.
Hi there, Gareth. Yes, so the idea actually formulated in COVID, believe it or not. So some good things actually have come out of COVID, whereby, as you can recall, during the COVID experience, nobody wanted to visit a doctor, nobody wanted to see a pharmacist. Everybody was petrified to go and see people due to the virus. South Africa's legislation, its digital legislation, also changed to adapt for those types of needs. And that's when we saw the opportunity to build a robust first world product for a third world problem in South Africa. So this evolved out of COVID.
And when we talk about online healthcare, digital healthcare, are we talking just medicine? Are we talking access to doctors, to specialists? How far down the rabbit hole does this go, Rodney?
So good point. It is quite a big rabbit hole, but what we are focusing on primary healthcare, and primary healthcare is a problem worldwide. It's not just a South African problem, but we've taken our telemedicine to the next level. And it's a big word I'm going to throw out to the viewers. It's called asynchronous telemedicine, and it's a first to South Africa and first to Africa, in our view, where we actually capture data with very intelligent IoT sensors prior to the consultation. So it's tiny medical equipment that's connected to our digital health program that then analyzes and gathers the digital information, whether it's photographs or whether it's videos, and that allows the doctor to make a comprehensive diagnosis before contacting the patient.
Because much of the concern when it comes to seeing a doctor is having to get an appointment, having to get yourself there, especially for those in rural areas and those who are elderly. They might not have the ability to get there. Who are the doctors? You have to give me the names, obviously, but I imagine you have a network of doctors who are signed up for this. As a patient, I register, I want to see a doctor, perhaps I have bronchitis. How does that process work?
So you've definitely identified some of the areas that are problematic. So the first thing is uneven distribution of health centres throughout South Africa, and also time constraints on getting to those health centres. So that's a big barrier in the market, and the cost to get to that health centre as well as availability. So those are the key problems that we're facing. What we've managed to do is we've gone out and employ permanent doctors. They work for us 24/7. They're not consultants. They're not on an Uber-type style business model. They're managed, and they in Bryanston, in Johannesburg, and we have constant new doctors being employed. So we see this as a massive way of employment drive for doctors that are leaving the studies. And unfortunately, the national healthcare at the moment is backed in to place these doctors. So we have a large influx of doctors joining our digital nerve centre, where all this data and all this information is collected, and then the diagnosis and scripts are issued.
I'm taking a look at your website, guardianeye.co.za, and there's that fancy word you used, asynchronous. I hope I said it correctly as well. It looks like this can actually be quite useful for companies and also their employees. Looks like you can get a doctor in 30 minutes, they can do the assessment, and if there's something wrong, you can actually get all the documentation done and even send it off to HR, so the bosses are happy.
100%. So there's another big word I'm going to throw at you, is the Bradford theory. The Bradford theory is what all HR managers consider as their Bible. And what we've identified when we've deployed AVA at sites, and our initial sites were just testing, and the testing data was across 5,000 patients or staff. And the data never lies, that we found that 33% of sick leave was reduced by placing an AVA app and an AVA IoT device at a company's premises.
I want to just get a sense. I'm trying to understand the nuts and bolts of this, Rodney. I'm looking at the website. I'm sure there's videos. I just haven't had a chance to look at it properly yet. What does the medical practitioner need to do this? What do I, as the patient, need to get onto this? How do they check my vitals? How do they know I'm not just lying and I want a day off work? What do I need? What's the nuts and bolts of the mechanics of this?
So in our experience, there is a way to manipulate telemedicine data. And that's why we insist that our IoT devices are on site. We either deploy an IoT AVA operator or medical operator at a customer site, but you don't have to be a medical practitioner. And that's the game changer. If you look what's happening in America and you look what's happening in Europe and even in India now, your healthcare is almost becoming a self-managed process, whereby with smart devices and accurate data and information, any person can be trained to do the basic GP sort of analysis, and that data then is obviously analyzed and diagnosed by a professional.
Because I'm taking a look at some of the exams that can be done as well. Temperature, breath, ear, sore throats. We're getting to the winter flu season, aren't we, as well? How widespread is this? Who's taking up something like Guardian Eye at the moment? Because I must be honest, before today, I haven't heard of this. Are large corporations getting hold of this? Companies in rural areas?
So once again, it is a first to market, and that's why you're starting to hear. You'll be seeing a lot more about us in the press and in the media and whatnot. But it's a first to market. It officially actually only launched 60 days ago. We were trialing and testing for the past 18 months. But as I mentioned earlier, this is a worldwide problem, and it's a worldwide solution where IoT medical devices are being deployed at even your mid-sized businesses. So many companies in South Africa are unfortunately not offering a medical aid or a medical aid insurance. So this fills that gap. And secondly, your big corporates, and we talk to several very large corporates, blue chips, they are seeing this as an add-on to their current medical aid benefit scheme, because generally what happens with medical aid is your primary savings is what runs out first. And this is for primary healthcare, and it's unlimited access for 12 months.
It's very, very clever. This, I think, is going to be the future of healthcare, considering how difficult it is to get access, considering the cost as well of health. And I wish you all the best. Rodney Taylor, MD of Guardian Eye. There's a lot to go through, actually. I didn't get a chance to go through all of it before speaking to Rodney, but he explained it beautifully. GuardianEye.co.za, as in I, not I, the letter. GuardianEye.co.za. All right, we're back with you in a moment as we